Hello, y'all. The holiday season is here. And listen, I don't know about y'all, but around the holidays, I tend to overindulge in the treats and all the foods and all the things that I know I don't need to be eating. And that can lead to reflux. And for some people, they have that reflux all the time. For other people, it is triggered specifically by certain foods. And I think there's a misconception out there that reflux just means that your stomach is making too much acid, but sometimes it can be the timing and the location of the acid within the gut and not necessarily just the amount. And a lot of reflux medications like PPIs, these are things like Nexium or Prilosec, can be amazing. They can work really well, but oftentimes I see people using them a lot longer than they need to, and that can lead to some issues. I want you to stay to the end of this video because I'm going to go through those medications, and at the end, I will talk about some of the issues that I want you to watch out for, because I see all the time people on doses of these medications, especially now that they are over the counter and they are on these medications at higher doses for too long of a time. They're not getting labs checked, and issues can happen. So in today's video, I'm going to talk to you specifically about how PPIs work, proton pump inhibitors. These are one of the main classes of medications that are used to treat acid reflux. There are some other classes as well, but we will talk about those in a different video. And I also want to talk about who truly needs these PPIs, how you take them correctly, and what to watch out for. There are some really key mineral issues that a lot of people don't connect to PPIs. And I really want to dive into that towards the end, because if you're having some issues, it might be because you've been on your PPI too long. And being in primary care, I see people all the time who are on like anti-anxiety medications and pain medications. And it is really hard for us to help patients kind of reduce the dose and come off of those medications. But I always tell my students, like a second or third in line medication that is hard for people to come off of are PPIs. People are really attached to them. And so if that's you, or if you've ever taken a PPI, if you know somebody taking over-the-counter acid medication, maybe you can check in with them and see which one they're taking. And it might be one of these. So we're going to talk about it. And if you are new to my channel, my name is Dr. Takova Wallace-Gay. I am a clinical primary care pharmacist. And my goal here on this channel is to help medications make sense for you. If you've ever felt confused about a medication when you've left the pharmacy or your doctor's office, that is normal. Like, we provide medications, we provide education, but people forget. We forget stuff. I say hello to people and then forget their name like 30 seconds later. And somehow we expect people to remember all the things about all of the medications all the time. It's not practical. So my hope and my goal here is to break things down in a way that really makes sense and simplifies it, so that you can feel more empowered to ask questions and to take your medications with more confidence and clarity. So I've got my notes here, and I will refer to those just so that I stay on track, because my last video was a little bit longer than I intended it to be. But also I am in a new location, so bear with me on that as well, as I'm kind of navigating what my space looks like. And otherwise, we're going to jump right into it. So starting off, what is a PPI? So I already mentioned PPI, proton pump inhibitor. It's a medication that basically tells your stomach, the acid making part of your stomach specifically, to turn that faucet way down. So when we eat, we need the stomach acid that we produce, that food helps us produce. It helps us break down the food. It helps us absorb certain minerals that we need to help our bodies thrive and do well, and all the nutrients. So that acid is necessary, but sometimes that faucet can be turned up too high, or there might be some other structural things going on that's causing that acid to come up or to reflux. So these medications, proton pump inhibitors, inhibit or stop that pump that helps produce or secrete that acid. So some of the main PPIs that we see, again, as I mentioned, they are over the counter now. So you can just walk into your pharmacy and get them. And it's been that way for a while. But back in the day, they weren't. They were only for prescription. And I think that's where a lot of issues have come in as well. But again, I'll talk about that later. But some of the main agents are Omeprazole. The brand name for that is Prilosec. Then you've got Omeprazole, which is like the first cousin or maybe a sibling of Omeprazole, and its brand name is Nexium. Then we have Pantoprazole, which is Protonix. And then we have Lansoprazole, which is Prevacid. And then there's another one called Rabeprazole, but we don't really see or use that one as often. And then we also have dexlansoprazole as well. So we've got all of these agents. They all end in azole, or really prazole, Prazole, omeprazole, pantoprazole, esomeprazole, lansoprazole, etc. So we've got all these agents, and as you know, they are for acid reflux, but they're also used for stomach ulcers. People often refer to reflux as heartburn, and so you might see it used for people referring to it as heartburn. And a lot of times people will start off using antacids, and then go to some other agents right after that. Again, I'll talk about that in a different video. But these PPIs are used very frequently for that heartburn or that reflux, as well as for stomach stomach ulcers. They can also help heal any inflammation in the esophagus. So they're sometimes used for that. And then if you're on certain medications like high doses of NSAIDs, which can be like ibuprofen or things like that for a long period of time, and there's some other meds as well that people can be on that might, kind of mess up that stomach lining. Like, we know that might happen. We can put you on a PPI to help protect that stomach lining a little bit if we know you're going to be on a medication that could damage it. We also use these medications in individuals who have H. pylori, which is an infection, and we'll use it in combination with antibiotics for that. So the problem is, or the twist is, that the PPIs don't fix the reflux. So if the main issue is that you have a weak valve between your stomach and your esophagus, and late at night you have meals and then lay down, and now that valve is weak and things are coming up, like, the PPI is not going to fix that. It's going to help turn down the dial on the acid that's being produced. So you might feel a little bit better because you're not producing as much acid, but the structural issue has not been fixed. And so sometimes we're covering up an issue that really we need to correct instead of put a Band-Aid on. And then also sometimes people are eating the trigger food. So that's why I started off with, like, the holidays are coming. So if you know you're about to eat some things triggering that reflux for you, you might be able to take a PPI or an antacid right before you eat. And that might be helpful just for the holiday season. But long term or every day, you probably just need to avoid the things that are triggering it, if at all possible. We tell people don't eat and lay down immediately, or if you do need to lay down, try to lay at a recline, so that that you're not providing an environment for that acid to just come right up. So again, we need to make sure that we're fixing the actual issue and not just putting the Band-Aid on it. So let's talk a little bit about how these PPIs work. I kind of alluded to it, but just a little bit more specifics and still just kind of keeping it simple. So your stomach has a bunch of little acid pumps in it. And the PPI, the proton pump inhibitor, basically shuts off a lot of those pumps. So less acid is being made overall. So PPIs are a little bit different from medications like Pepcid, which is famotidine. That's something that we call a H2 blocker or histamine blocker. Those turn down the acid a little bit, and they work a lot quicker. So you can use them just like in the moment or right before bed, and they work well. But PPIs are going to turn down the acid a lot more. And they also take a little bit more time to take into effect. So keep that in mind. And I'll talk about the H2 blockers in a different video at a different time. So let's go through like maybe some things that I feel like I see a lot in terms of mistakes with PPIs. So one thing is that people will take them like right when they're getting ready to eat, like right as they sit down to eat. More often than not, the PPIs are going to work best if you take them 30 to 60 minutes before a meal. And they're typically taken once a day. There are some situations where we will do it twice a day, especially if you're being seen by your healthcare provider and they're prescribing it for you. But most often people will take it once a day. And if so, you need to take it like 30 to 60 minutes before breakfast, because it's going to work best if you haven't already activated those pumps. So you haven't had anything to eat yet. So 30 to 60 minutes before breakfast. That just gives the medication time to like get in your system, work on those pumps, turn them down so that when you do actually eat, you don't have as much acid produced. And so I know that also sometimes people will take a dose and they feel like it's not working. Optimally, the best way to do this is to use it for multiple days. so that you give it time for those pumps to turn off over the course of like a few days. So if you take it once and you don't feel like it's doing anything, it might be because your body just has not responded fully to that dose of medication or to that one dose of medication. Another thing I want everybody to keep in mind is that these are not meant to be taken long term. So you really only want to take them for like 6 weeks or so, 4 to 6 weeks. Some people will say up to 12 weeks as well is okay, but really you don't want to take them long term. Now, the problem is that they start to work really well. And then people feel like they need them long term, or they feel like they have to have it, otherwise they can't function. And if that's the case, again, I would, really, 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 really strongly encourage you to go see if there's some other structural thing going on. I feel like I was doing like 6-7 just then. Oh my gosh. And my kids are little, like they don't even know what 6-7 is, but my nieces and nephews. Ugh. Okay. Anyway, structural issues going on. So if you have a history of severe esophagitis, like inflammation in the esophagus, or if you've got something called Barrett's esophagus, that's something that needs to be talked to by a GI doctor. You might have some ongoing risk for having an ulcer, in which we talked about before. So if you're on certain medications or have certain conditions that increase your risk of having a stomach ulcer, then you might be on the PPI long term. But most people do not need a PPI long term. 12 weeks should be enough. We should figure out what the issue is, correct it, and then move forward from there. Or you can take it, as you're going into a season or a moment where you know that you might have some reflux. Maybe stress is something that triggers reflux for you, and you're going into a stressful exam in a week. You might take it, for that week or something like that. So again, you don't really want to take it for months and months and months, or definitely not years, without asking yourself, what is the reason I'm using this? Is there something that I can do to prevent this without the medication? Also, do I still need the same dose? So if you're on a higher dose, like 40 milligrams of Omeprazole, could you come down to 20 and really just start to reevaluate there and determine whether or not you need the medication? All right. The next thing is something called the PPI rebound trap. So some people will stop the medication and they can start to feel worse. So when you stop the medication suddenly without tapering off of it or giving yourself some time to let your body get acclimated to not being on it, especially if you've been on it for a really long time, your stomach can temporarily overcorrect. So you've been, numbing or turning down the faucet on these pumps for a while, and then you just abruptly remove the thing that was doing that, and then the pumps rebound and they overcorrect and they make extra acid. And we call that rebound acid. It can make you feel like you need a PPI forever, because then you're like, oh my God, I came off my drug. I came off my med for a couple of days and my reflux just came right back. Instead of quitting it cold turkey, we would prefer for you to do a step down plan. So if you're on a higher dose, step down to a lower dose and do that for a few days. Once you're on that lower dose, every other day for maybe like a week or so. And then from there, you can step down to something like a H2 blocker, Pepsid, for a few days, or just as needed, and then come completely off of it. I think it's good to just kind of talk to the pharmacist or talk to your physician if you feel like you don't quite understand how to come off of it, but you want to try to come off of it. And I really do encourage everyone, unless you have one of those long-term reasons to be on it all the time, try to come off of it. If it doesn't work for you, if you feel like you absolutely need something, try the H2 blocker. If that does not work for you, like the famotidine, Pepsid, if that does not work for you, then step back up to the PPI. But definitely give your body a break from it and just see if you can do well without it. The other thing is lifestyle fixes can definitely make the medication work better. So I talked about this a little bit, but don't lie down for 2 to 3 hours after you eat. Try to sit upright, or at least sit at somewhat of a recline. If you are consuming large portions, try to do smaller portions or eat your dinner earlier. And if you find that even if you wait the 2 to 3 hours before you lay down and you still have reflux, you can usually raise the head of your bed a little bit, or sleep on multiple pillows, or sleep at a recline, unfortunately, and that can sometimes help. Some really common triggers for people are things like alcohol, peppermint, chocolate, which has caffeine in it, coffee, obviously caffeine, Acidic and spicy foods is a big one, but it really varies from person to person. So just try to keep an eye on what you might be eating or doing that's triggering that. And that might be something that you can avoid or try to limit. And then sometimes weight changes. So if, even if it's just like modest weight changes, like you lose a little bit of weight or gain a little bit of weight, that can trigger reflux issues for people. And so just, watch out for that as well. All right. So some side effects to watch out for. Most people tolerate them really well, especially short term. There's not a lot of issues with taking PPIs, but some people do present with slight headaches. They might have diarrhea or even constipation, just depending on kind of how your body reacts to it. Some nausea or bloating might be associated with it as well. And then long term, the bigger issue that I'm concerned with is the the mineral absorption issues. So here's the thing that I really wanted to talk to you about. We've made it to the moment. And this is the thing that I feel like I counsel so many people, not just patients. Like when I'm talking to the physician residents that I help precept or teach in clinic, as well as the medical students, the pharmacy students, one of the big things that I try to, draw in their mind to bring forth to their patients is that there are nutrients that we need to absorb, and that stomach acid is helping us absorb. So if you're turning off or turning down those pumps for longer than 6 months, then you're also preventing optimal absorption of certain nutrients. So long term, people can run into issues like low magnesium or lower calcium absorption. And so magnesium is one of those tricky ones too, because even if you're getting all your labs checked, magnesium is not a part of the basic lab panel. So you have to ask to have your magnesium checked, or your provider has to put in a separate order for magnesium to be checked. Because when they put in your annual labs to check all the things, we call that a complete metabolic panel. Magnesium is not a part of that. And so if you're noticing muscle cramps or twitching, feeling shaky or unusually tired, fatigue, sometimes it can be heart fluttering or palpitations, and you definitely do not want to ignore that. And in really serious cases, you can have rhythm issues with the heart. And so that magnesium is important. And so you need to make sure that you're having it checked, and also trying to limit how long you're on the PPI when you can, so that you hopefully don't fall into issues where you're not absorbing your magnesium optimally or appropriately. And then we've got calcium, which is another big one. And to be clear, like they can reduce absorption of many minerals and nutrients, but I'm just focusing on magnesium and calcium because I feel like these are two big ones. But calcium is another big one. Your body can only absorb so much calcium at a time. Then if you're on the PPI, especially long term, you're reducing the optimal absorption of the amount that would have been absorbed. And so that can lead to issues with bone health. So it definitely needs to be part of the conversation. You might be feeling some bone pain or just achy overall. So make sure that you're either taking a calcium supplement, limiting the amount of time that you're on the PPI. So get your magnesium checked, make sure your calcium is getting checked, double check your dose, see if you can step down from the PPI to a different agent or to a lower dose of it. And then talk to your provider, talk about your bone health issues. Maybe you're someone who already has a higher risk of things like osteoporosis. And we definitely don't want to prevent or reduce absorption of calcium if that is you. Maybe you're someone who is struggling with arthritis. And even in that case, we want you to hold on to the things that are making your bones strong. So you need the calcium, you need all the things that you can get. And so please, please, please do not stay on these PPIs for too long. If you are having trouble swallowing, if food is getting stuck, if you're vomiting, if your stools are black, tarry, if you're having unexplained weight loss or chest pain, things like that, those are symptoms that could be related to an underlying issue that the PPI might be covering up a little bit. And you definitely need to contact your healthcare provider and talk to them and get in to see, get a referral to see GI specialist so that you can figure out what the issue is. So all that to say, quick recap. PPIs, proton pump inhibitors, are going to turn down your stomach acid pumps so that you're not producing as much acid, and therefore we are reducing the amount of acid available to be refluxed. Most of the time, optimally, you need to take it 30 to 60 minutes before breakfast. So empty stomach, 30 to 60 minutes before breakfast, and do not stop it suddenly, especially if you've been on it for a long time. So I would say if you've been taking it longer than about 6 weeks, 6 to 8 weeks, you don't want to stop it abruptly. You want to we call it tapering down. You want to come down or taper down off of it slowly and strategically. And you can ask your provider or your pharmacist about a step-down approach to do that based on your dose and how long you've been taking it. Watch out for the long-term issues. Magnesium, calcium, bone health, heart health, those things matter and are really important. And you definitely need to watch out for it. I hope this video helped you. Please hit the like button, subscribe to my channel, y'all. I want to do more videos. Let me know if there's a medication that you've been worried about or thinking about. If you have questions about your reflux pill that you've specifically been on. And if you haven't already, consider grabbing my medication mind map guide. It really will help you look at all of your medications, why you're taking them, what they're for, and just write that out. And we know learning science tells us if you write things down, if you conceptually can see it, you understand it better, you remember it better, you can explain it better. And you need to be able to explain it to the people around you, all of your medications, to the people around you in case something happens or so that they can help you out. So with that being said, I will see you guys next time. And I hope that this helped you feel a little bit more like the CEO of your medications.